What if I told you that some cancers are not just bad luck or genetics, but are caused by infections? Infections many people already have. Infections that are preventable, treatable, and sometimes curable. Today, we're uncovering the hidden infections that cause cancer and, most importantly, how you can protect yourself and those you love. Many people believe cancer is caused only by genetics or lifestyle, but here's a powerful fact. About 15 to 20% of cancers worldwide are linked to infections. That means millions of cancers are potentially preventable. Let's talk about which infections, how they cause cancer, and what you can do today. Cancer doesn't happen overnight. Certain infections cause cancer by creating long-term inflammation, damaging the DNA inside our cells, weakening the immune system, or directly switching on cancer-causing genes. This damage builds slowly, often over years or decades, until normal cells become cancerous. Now, let's talk about the major infections responsible. Human papillomavirus, or HPV. HPV is the #1 infection-linked cause of cancer worldwide. It is responsible for cervical cancer, almost 99% of cases, anal cancer, throat and oropharyngeal cancers. HPV is extremely common. Most people will be exposed at some point, but persistent infection is what leads to cancer. How to protect yourself? HPV vaccination, regular pap smear and HPV testing for women, early treatment of precancerous lesions. Cervical cancer is one of the most preventable cancers, yet still kills thousands yearly, especially in Africa due to lack of screening. Hepatitis B and Hepatitis C viruses. These viruses attack the liver and often cause chronic infection without symptoms. Over time, they lead to liver scarring, cirrhosis, and liver cancer. Many people are infected without knowing because symptoms may not appear for years. Hepatitis B vaccination, very effective. Screening for hepatitis B and C. Proper treatment if infected. Liver cancer is often diagnosed late, but hepatitis-related liver cancer is preventable. Helicobacter pylori. This is a bacterium, not a virus, and it lives in the stomach and infects millions of people worldwide, especially in developing countries where it is acquired early in childhood. It causes chronic gastritis, stomach ulcers, stomach cancer, and certain lymphomas of the stomach. How to protect yourself? Testing for persistent indigestion or stomach pain. Complete antibiotic treatment when detected. Safe food and clean water. Epstein-Barr Virus, or EBV. EBV is one of the most common viruses worldwide. Once infected, it stays in the body for life. It is linked to nasopharyngeal cancer, certain lymphomas, and some stomach cancers. Protection. There is no vaccine yet, but early evaluation of persistent lymph node swelling, prompt medical care for unexplained symptoms, strong immune health. Human immunodeficiency virus, or HIV. HIV doesn't directly cause cancer, but it weakens the immune system, allowing cancer-causing viruses to act freely. Associated cancers include Kaposi sarcoma, cervical cancer, and certain lymphomas. Parasitic infections, often overlooked, schistosomiasis or bilharzia. This parasitic infection affects millions. It is common in parts of Africa with contaminated fresh water. Avoid swimming in contaminated fresh water. Early diagnosis and treatment. Key take-home prevention strategy. You can reduce infection-related cancer risk by vaccination, HPV, hepatitis B, regular screening, safe food and water. Early treatment of infections, strengthening health systems. Cancer prevention doesn't start in the oncology ward. It starts with public health and awareness. Here's the most important message I want you to remember. Some cancers are preventable, some are detectable early, and some can be stopped before they ever begin. Awareness leads to prevention. Prevention leads to longer, healthier lives. Together, we can reduce the global burden of cancer.